What's going on, everyone? Happy Tuesday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Tuesday edition of the Pandemic Update for Tuesday, February 27th, 2024. If you're new to my channel, this is where we do the daily pandemic update on all things COVID and any other virus that could be a threat to you, such as influenza, flu, measles, norovirus is spreading right now. RSV was an issue back in the fall into the start of winter. A lot of different viruses. You want to stay informed on them? Subscribe to my channel down below. Want to help keep others informed? Share these videos and give them a thumbs up if you like them, because guess what? The more likes we get, the more YouTube will push this through the algorithm. Let's try and get 100 likes today and see what that does. Alrighty, we have several news stories to talk about today, and we do have some data to look at, including wastewater and a few states. But first, I have to update you on a story that I talked about yesterday, a personal note. Remember I said I was supposed to go to the dentist today? Well, here's the update on that. It was a no-go. I got a phone call this morning from the dental office saying, "Oh, we can take you early. We're not busy today. They had openings galore. Can you get here now?" I'm like, "Yeah, I can get there now." I was in the area. I was delivering in that area. However, I arrive, I go inside, no one there. Eventually, someone else did walk in. They said, "Oh, we no longer take your dental insurance. We used to take this insurance. We don't take it anymore." I said, "Okay, let me try on my healthcare plan." My healthcare plan also has dental on there. Well, they didn't take that either. This is all through the government, and it's kind of concerning because my dental insurance, I will name the company, DentaQuest. They need to update their list. You can enter in on their website, within a radius. You can set it 5 miles, 10 miles, 15, 25, whatever. I think up to 100 miles. There's a whole bunch of dentists listed on there that when you call them up, they're like, "Oh, we don't know who that is," or they come out and say that, "Oh, we no longer take that anymore. We don't deal with that anymore." It's just ridiculous, but yet it's still on their list. It needs to be updated. It is very outdated. I mean, dealing with healthcare in the United States, for those of you that watch me that are not in the United States, there is definitely flaws in the healthcare system in the United States. That goes for regular healthcare, dental, vision care, whatever you may be dealing with. There are flaws if you're dealing with just the basic system. I saw something yesterday from the former Surgeon General. He had an ER bill that was, I think, close to $5,000. I mean, ridiculous. And he has good health care. Mind you, he's a physician that should have good health care. It's just ridiculous, the issues that people deal with in healthcare in the United States, and we need to do better. Something needs to be done. We have Bernie Sanders out there, but that's not good enough. Something needs to be done with healthcare in the United States. So, the long story short, getting back to the story, I called around more places. Finally, I found a place that is going to take me tomorrow. I asked them several times, "You do take my DentaQuest coverage?" And they said, "Yes, we take your DentaQuest coverage." Okay, we'll see what happens. It's an appointment 9 a.m. tomorrow morning. I'll keep you updated on how that goes. Let's get into today's pandemic update. We're going to start off with some good news today. California bill would require employers to continue compensation for COVID-19 positive employees excluded from the workplace. If you test positive, you're out of work. Guess what? They're going to be required to compensate you for that. You're going to be paid for that. Quite frankly, I think this should be done in all states. Slowly but surely, we're starting to see more people in the political world get a dose of reality when it comes to COVID and long COVID. There are some people in Senate, a couple Senate members that have long COVID. So I think even the Republicans that are, so stubborn to admit that COVID is a big deal, I think even them, they are slowly but surely starting to wake up. Now remember, California, being a Democratic state, this is a good thing. Maybe what they're doing here can spread to other states, and quite frankly, to me, it is a little bit of a surprise. You're going, "Well, why is this a surprise?" It's a good thing. It's a surprise because they came out with that quarantine rule for schools, offices, whatever else. They're saying, "Oh, well, if you're not having X amount of symptoms and you're fever-free for 24 hours, you can go in person while positive." So it's kind of interesting to see that they at least still take this seriously. Moving on to our next story now, where we have to talk about Florida. We've been talking about this day after day now. The Florida outbreak has grown even bigger. One of the posters on my website, actually a moderator, who always posts fantastic content, says, remember Florida, Broward County, Florida? Well, Broward County, Florida is now up to 9 cases, and Polk County, Florida, has that one case still. So the total number in Florida is 10 cases. Each day it seems like this is going up, and I don't think it's going to stop here at this point. Measles spreads relatively rapidly, and take a look at this. News Nation. I really like News Nation, the stuff they do on their channel. Their slogan is news for all of America, and it really is. It's really split right down the middle. They don't take sides of the political party. They report things the way it should be reported. And they're talking about measles. This is great. They also have been on top of COVID lately. I mean, they've been doing a lot of COVID stuff. Chris Como, maybe you don't like him, maybe you do. He's at least giving COVID a lot of airtime on his program for the last month now, which find anyone else who's doing that lately. They're really, you can't on cable news TV or any news TV. U.S. on track for nearly a 300% increase in measles cases. At least 35 cases in 15 states have been reported so far in 2024. If the pace continues, it would nearly be a 300% increase over 2023. Measles can prevent with the MMR vaccine available from the 1960s. And I'll say this again, I think what we're going to see happen here with measles in the end result is going to be very much similar to the 2022 Mpox outbreak. It's going to go up for a while. We're going to be talking about it probably for the next couple months, and then maybe it'll slowly go down, and we won't hear much about it anymore. I don't know. I'm just speculating. My hope is that's what happens, but we'll see. I mean, there is potentially room for it to continue to spread even further. All right, we have to talk about Vermont. When's the last time we talked about COVID in Vermont? It's been quite some time, hasn't it? Well, anyhow, Vermont Department of Health COVID cases continue to slowly decline at this time, and you can see that here. Now this data, it's a little bit outdated. It's actually 10 days outdated, but if you take a look at the chart here, hospitalizations in Vermont, they have been going down from the 7-day rolling average. So these are daily hospitalizations with COVID-19 diagnosis. So these are people that are being admitted daily. Looks like it's down to just 4 at this point being admitted for COVID in the hospitals in Vermont. And it does say in this update they added 4 more fatalities. Their total as of February 17th is 1,128 fatalities. You know, it wasn't all that long ago. Vermont did not have 1,000 COVID deaths, but they now do. That's, if you think about it, 1,128, that's a lot from a virus in a state that only has about 600,000 residents. I know the number's been going up. They'll probably hit 700,000 residents within probably the next decade because Vermont is a growing state. They're getting a lot of people moving up from New York now. But, yeah, so that's the latest from Vermont. We haven't talked about Vermont in quite some time. All right, if you did not see yesterday, in the last week, there was another 1,569 COVID deaths added in the U.S., and another 1,000 flu deaths were added as well. We have to talk about air quality. It's not great. As a matter of fact, there's some problem areas, and you're going to see that pop up here. Yeah, look at the east of the Mississippi River. Seeing a lot of yellows, a lot of oranges on here. What that's from is there's a southwest flow. Some places it got really warm, like Texas, and across portions of Kentucky area. Matter of fact, the Paducah, Kentucky National Weather Service office actually had a location within their office area that hit 90 degrees today. Unheard of for February. But when you're coupling that with the fact that there's wildfires going on to the west, yes, that does create some air quality problems, and air quality is not good for the health. I know it's been impacting my breathing today. You may hear it today. My throat's been getting clogged up quite often today. It's because look at these air quality values across Pennsylvania. They're just absolutely terrible. You're seeing hundreds across central Pennsylvania, slightly better along the I-95 corridor. Obviously, it's a lot better than what it was last summer, but it's not good. All right, moving on. We do have another channel where we talk about weather, and yes, sometimes air quality as well. It is Climate Data Report. We're going to be talking about severe weather tonight. I am going to be tweeting on my other account tonight I have multiple Twitter accounts, and I'm going to be tweeting like crazy over on my weather one because there's a tornado potential if you're in the Ohio Valley or if you're in Chicago area. I know I got some Chicago followers. You might want to watch that video. There's large hail and tornado potential for you tonight. There'll be a link to my other channel down below. All right, moving on now. Philadelphia, significant increase in EMS calls from what happened on Sunday. I think this is the classic case of, well, if I'm still feeling bad on Monday, I'll call the EMS. And I think a lot of people did that because EMS call volume for Sunday was very low. One of the lowest days of the entire pandemic since I've been watching them, which I've been watching them for many years. 787 EMS calls in my city of Philadelphia yesterday. Let's take a live look at the burbs. And yes, there are calls to be had right now in Montgomery County. I am seeing stroke listed several times, cardiac emergencies, respiratory emergencies, diabetic emergencies, and just so you know, I know it may not always be COVID related, but we do know COVID can cause significant complications to diabetes, and if you never had it, guess what? COVID can cause you to develop diabetes. Look it up on my website. There are several studies that have been posted, and coming soon, I will get around to it. I have it listed right here on a sticky note. Diabetes section, it is coming to the COVID studies because I am sure we are going to start to add studies to that. There's already studies on there. I'm pretty sure that is going to fill up within time because we're going to find out more of just what COVID can do for diabetes because it's not good. COVID does so many bad things, doesn't it? All right, let's take a look at some hospital capacity data across the country. The ICU number first, and 72% of all ICU beds are used in the United States. 2.3% are for COVID, 1.3% are for influenza. Inpatient beds being used, 76.6%. And 2.5% is for COVID, 1.1% is for influenza. We did get a Walgreens update yesterday, but I gotta tell you, it wasn't the best of an update. A lot of states did not report. Testing was really low. So while it dropped, there's just a lot of problems here with testing, but it did drop in a good way, though. A lot of states that were lower for testing did not see increases in positivity. National positivity rate, though likely inaccurate, 17.3%. Prior week, 24.2%. Difference of down 7%. Just 3,047 tests versus 15,476. Which again, that is a significant decrease. Hopefully we get this rectified next week. Hard to say though. We're starting to come into, as cases drop now, less people are going to have a need to get tested. But I should remind you of something. March is coming right around the corner. What happens in March? Well, I know. St. Patrick's Day. Maybe Walgreens is decorating themselves in green for St. Patrick's Day. No, not likely, but St. Patrick's Day falls on a weekend this year. There's going to be a lot of people going out to bars, pub crawls. Any bar that's not Irish will be Irish for St. Patrick's Day. Yes, this is something to be concerned about. It has led to spikes and rises in COVID cases in the past. It could this go around, not being forecasted right now by the COVID modeling, but keep an eye. Each individual area is different. I constantly talk about this. It comes down to your local community. Don't follow the national trend. If you live in an area where St. Patrick's Day is a real big to-do, keep an eye on the wastewater post St. Patrick's Day. It could definitely be rising in your community because of that. All right, let's take a look at some wastewater sites now across the United States. We're just going to do a couple here. Let's take a look and see what's going on. How about we come down here to Fredericksburg, Virginia. I don't recall clicking on this in a little while. And speaking of Little Falls Run is the location. This is just south of Fredericksburg. And you can see COVID low at this time. RSV low. Influenza A is low and not really rising. Influenza B is starting to rise at this point. Norovirus, it's an issue. Norovirus is really starting to make the news at this point in time, and this is another area where it's rising. We know it's rising most in the northeastern states of the United States. In fact, we'll take a look at a northeastern wastewater site next. Mpox, not an issue at this time, but again, norovirus would be the most concerning thing rising at this wastewater site. COVID is not rising at this time. How about we go up to Stamford, Connecticut? We have not gone there in some time. COVID is medium and dropping really nicely. RSV is still listed as high, but quite frankly, it's down near zero. Why is that high? I don't know what the deal is with their calculations. I don't think these calculations update all that frequently. Influenza A is dropping, B is holding steady, HMPV is dropping at this time, and norovirus in Stamford, Connecticut, after a rise through much of January through the middle of February, is now starting to drop, and no detections of Mpox at this time. To be fair, let's go out to the West Coast. How about we go and take a look at what's going on in sunny California? How about Los Angeles? We'll do this central wastewater site here, and we'll see what's going on. 3.5 million population, low for COVID at this time, medium for RSV. Again, I don't know if these calculations update all the time, because you can see here, if you look at the chart, it's really down low. Same with influenza. Both A and B are low at this time, and no detections of Mpox, and norovirus is in the medium category at this time, and it's not rising in that area. All right, taking a look now at some CDC data, JN.1. We're going to get an update on this later this week. It's 96.4% across the United States. That's a really high level. I'm not expecting any new variants to pop up here. Maybe one of them odd, random ones could appear, but right now I'm not hearing any rumblings yet. I'll keep an eye out, though. If anyone's posting anything on Twitter, here's the latest flu data. We can see here some high levels to be had, and still some areas with very high levels. Taking a look at the hospital data, drum roll please, this is from New Jersey. 587 hospitalizations. They continue to drop. Though, we do take note here, when we zoom it in, it's not dropping as fast. In fact, it's actually leveled off a little bit. And it did actually, you know what? There was a slight rise today. It went from 576 to 587. So a slight rise, but the overall trajectory is dropping. We'll have to see here. Will they just bounce off the bottom, or will they continue to go lower? I don't know, but it does look like the drop has slowed off just a little bit. 69 out of 70 hospitals reporting today. 28 people on a ventilator, 75 in the ICU, and let's see, discharges, 76 people discharged. New York State, fantastic news, just 803 positives. I know, it doesn't include those at-home tests, but hey, the number is dropping, so we suspect the levels continue to drop. Hospitalizations continue to drop, 1,177, and 138 people in the ICU. The wild card for the week of New York State is, will they get below 1,000 hospitalizations? If not, I suspect it should happen next week. Alrighty, guys, that does it for today's pandemic update. We'll have another one again tomorrow. If you like this update, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. And by all means, share this with anyone you know. If you want to support my work and help the channel, by all means, there's ways to do that down below. I will see you guys all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Tuesday evening. Thanks for watching.